Hi, everyone, and good morning or good afternoon from wherever you're tuning in today, whether it's in Canada or abroad. We really appreciate you coming on to our second iteration of two webinars on the clinical management of infected wounds, antimicrobial innovations. And before we get started, I just want to do a quick little icebreaker as usual. If you want to click on your chat button in your Zoom toolbar, I'll ask you to just type in where you're tuning in from today. I know because we're in the middle of the workday for some people, you might be at your facility, you might be working from home, you might be off today, you might be running around doing a couple things. It'd be awesome to see where you're tuning in from. My name's Troy, and I'm the Director of Operations from Nurses Specialized in Wound, Ostomy, and Continence Canada. I'm tuning in from Ottawa, Ontario here, and I'm super thrilled to have our guest speaker today, Theresa Wilson, who's tuning in from Knoxville, Tennessee. Before I introduce her and our topic, just a couple other housekeeping items. Firstly, we're going to have a Q&A portion at the end of this webinar. So we do encourage you to put some questions into that Q&A toolbox that you see on your Zoom toolbar there. That'll make sure that both Theresa and I can see those. We can get to those questions at the end as well. We are recording today's session, so if you're coming in a little bit late or you want to share this with a colleague in the future, we will have it available on our website a little bit later this week. So do stay tuned for that. We also will be giving a certificate of attendance to everyone who's coming on live today, so don't worry about that. Again, we'll be coming in just before the end of the week. So without further ado, I'm happy to introduce our guest speaker today, Theresa, who has over 18 years of experience as a clinical practitioner, primarily focusing on advanced wound and ostomy care in inpatient, outpatient, and industry settings. Her unique combination of global professional experiences as an industry product and clinical support leader and as an advanced practice clinician provides our MedTech Solutions Group partners, clients, distributors, and end users with the highest level of ongoing support to assist in the growth of product portfolios through enhanced product knowledge, clinical education, and utilization. So Theresa also helps to lead the MTSG clinical specialist team worldwide. Possessing a Bachelor of Science in Nursing from the University of Maine and a Master of Science in Nursing Leadership and Management from Western Governors University. She's also a full-scope wound, ostomy, and continence nurse specialist, holds memberships in both the WOCN Society, is a SCR WOCN affiliate, and participates in the Association for the Advancement of Wound Care. Theresa is also a fellow of the American Academy of Wound Care Specialists and a diplomat in the American Professional Wound Care Association. She has been an invited speaker and expert for multiple international conferences, including the UMA Global Conference, our Wounds Australia, Panama Wound Society, and the Vietnam Global Conference. With a passion for nursing, wound care, and education, Theresa has continued to strive to bring best practice education with clinically focused training programs and be an ongoing resource for clinicians globally. So again, thank you to MedTech Solutions Group for being able to offer this education today. Thank you, Theresa, for being with us a second time, and I'll pass over the mic and the slides to you.
Wonderful, thank you. So welcome to today's session. Some are watching this for the first time, some are coming back for the second time, and welcome back. We are going to cover the clinical management of infected wounds today, and really looking at discussing some antimicrobial innovations with a couple different products that are in Canada at this point and being brought through with Stevens in the region. So while we go through this presentation today, we are going to look and review the damage cascade for infected wounds. You are all in wound care, we all understand this cascade, but we're just going to do a quick review over it and go through some information about that cascade. We'll look and identify initial clinical interventions and differentiate use of topical antimicrobial agents. Different topical antimicrobial agents are in the market, and really look at their features and benefits. And lastly, I'm going to describe the antimicrobial actions of Anasept. So Anasept is an antimicrobial solution in gel. So we will look at that product, as well as Silverlon plated antimicrobial dressings. So those are the objectives for today, and I hope that you enjoy and learn something with this presentation today. So the damage cascade for wound infections, each pathway is the same. And so there are some differences in the pathways that we do see with certain types of wounds and different comorbidities. There is a diverse microbial flora that's associated with the skin and mucous membranes of every human being from shortly after birth until death. That normal microbial flora is relatively stable. And with specific different genres that populate various regions of our body and during different periods of our body too, of our individual lives. Even though most of those elements of the normal microbial flora that are inhabiting our human skin are harmless in us or healthy individuals, these organisms absolutely can cause disease in compromised hosts, especially when the skin's protective layer has been compromised, like our wounds that we see all the time. If you follow that pathway, that damage pathway from wound onset to infection, you're going to see that there's very few differences that occur with every type of wound, whether it is our diabetic patients, our surgical patients, acute, chronic. If it becomes infected, there are very few differences that you would recognize between that cascade. So let's look at that start of what happens in our normal microbial flora in our intact skin. That normal skin flora provides that good example of various microenvironments that the composition of our dermal microflora varies from site to site according to the characteristic of our microenvironment. So let's think about the different types of the body. A different bacterial flora characterizes each of our three regions of skin. You have your axilla, your perineum, and toe webs. You have your hand, face, and trunk, and you have your upper legs and arms, those exposed areas. Skin sites with partial occlusion, like your axilla, your perineum, your toe webs, harbor more microorganisms than some of those less occluded areas, like your legs, arms, maybe even your trunk. The quantitative differences might relate to the increased amount of moisture, higher body temperature, increased concentrations of skin surface lipids. There are so many reasons why there could be differences in the bacteria counts in those areas. The axilla and perineum, toe webs, those are going to be more frequently colonized by gram-negative bacilli than your drier areas of your skin. So we got to think about the microbiology. When we look at the microbiology, there are differences in how they measure microbiology on our body. And really, there's not a great consistency. So we want to just look and think about if it's intact, what are we dealing with? What happens when it's intact? It's not bothering our skin. It's not bothering our tissues. So we move on to an acute wound injury. And so everyone here knows the wound healing pathways. When acute wound injury occurs, we know that skin that was intact now has an injury. That intact skin that contains that normal non-pathogenic flora, as long as the skin is intact, now has become compromised. Once that protective barrier of the skin has been breached through any means, whether it's a scrape, a cut, an incision, stab wound, gunshot wounds, motor vehicle accidents, anything really, the external non-pathogenic flora becomes internal pathogenic flora. So there's a major difference between those two things. This then mixes with our foreign debris that potentially happens during that injury as well. You get bleeding, platelet aggregation through that hemostasis phase, which you all know about, and then the aggression of histamines, cytokines, all the other cellular components that influx to the tissue during that inflammatory phase. So that acute wound injury, that part of the injury is very important. And we want to be able to be sure that we're treating these patients properly with the proper products as well to help prevent progression of infection to occur. So then what happens? If your progression, then that pathogenic flora replicates, we can have significant issues. During that inflammatory phase, if allowed, the pathogenic flora will begin to replicate. We want to be sure that we control and eliminate as much of these foreign invaders as possible. But often, and not because we aren't trying, but often we fall short, which allows that proliferation of the pathogenic flora to occur. A lot of that is due to our host. And so our host that we are dealing with in wound care often is compromised and they have defenses that fail. So, but also we can help with that host and trying to help prevent those defenses from failing. And so inadequate cleaning is a major issue. And so today we are going to talk about some cleansing agents too. Inadequate cleaning is very important. Inadequate access to that deep tissue bacteria is also important. often we're not treating these patients with both topically and systemic medications. And so we have to think about that. When do we need that? The comorbidities, of course, play a role, and as we all know. And then when you're getting that increase of pathogenic flora, you're going to increase those interstitial pressures on the body. We are going to decrease tissue perfusion. So we're going to get swelling, we're going to get redness, we're going to get pain, we're going to get a lot of different problems to occur when these pathogens replicate to a infection or causing those further issues. When you look at your cells through healing, and this, again, we are all wound care people here. We know what happens when a wound injury occurs. Our body is attracting so many natural healing factors to the wounded area, and we're trying to get that wound to progress through an acute wound healing phase. We want it to go through very quickly and heal very quickly so it doesn't become a chronic wound. That's something that we can't often prevent from happening, and that has a lot to do with our host. While our number one goal is to stop that pathogenic proliferation, we also need to protect the healthy cells that are vital throughout that healing process. And so if we look at the most important cells and structures during the first 15 days of the healing cycle, you will see the influx of platelets, neutrophils, macrophages, lymphocytes that all play a vital role in bioburden control. And then your fibroblasts, which are followed by the formation of your new capillary perfusion channels. And then your keratinocytes come in, and that's when we epithelialize. We have to think about products. Some products are dangerous to use on fibroblasts or cytotoxic to use on fibroblasts or keratinocytes. And so you really want to look at your products and look at the research that has been done with those products. Are they going to affect your fibroblasts? Are they going to affect your keratinocytes? And we really have to take a look at those things and make sure that we understand the products we're using. That bioburden control after that first initial 24 hours of the injury becomes that balancing act between the good bacteria and killing the bad bacteria off. We need good bacteria. We need good flora in our body. That is something that's naturally there. But if we don't kill off those bad bacteria or prevent some of that good bacteria from proliferating into an overgrowth, that's when we have problems. And so when it comes to choice of your products, you must look at the IFUs. Please look at the IFUs, the MSDS, your 510Ks. Determine how that product is made, the amount of the actives that are present in the product. If the products can cause problems to any of these vital cells. Many silvers can have product issues with fibroblasts and keratinocytes. And so you want to look at that and the information that's written in the IFUs and the 510Ks of these products. And it gives you a lot of information if you just look through those documents as well. When healing is your ultimate goal, we've got to be sure we're choosing the right products for our patients. So when we look at that progression of pathogen to infection, this is something that we've all seen before. Contamination, we have every bit of our skin, every bit of everything in this world is contaminated with bacteria. Those pathogens live everywhere. And so when it's contaminated, we don't have the replication. That is, it's contaminated with bacteria. The microorganisms are there in the wound and around the wound. Do not forget the peri-wounds. That is a very important area that you must be able to keep clean as well, because there are pathogens on the peri-wound that could affect that open area. Colonization is when you have replicating bacteria, but it's still not causing any damage or cellular damage to the host. Now, these two areas are really important because this is when we're not thinking problematic issues with our wounds. But these are very important areas where we can also help to prevent infections or critical colonization from occurring. We can start using products that are going to help treat the bacteria, kill any bad bacteria, and prevent replication of those bacteria from occurring. With your critical colonization, now we've kind of missed that opportunity, but we can still absolutely help to treat and prevent further issues from occurring. This is when we're going to have delayed healing and we're going to have pain, tenderness, possibly increased exudate or different types of exudate that are occurring in the wound. We're going to get tissue color changes, different types of tissues in these wounds at this point. This is when we're going to see our wounds progressing to that chronic area. And so you also may see odor with critical colonization and increase of that pathogen. Odor can absolutely occur. And then localized and systemic infections. We also have seen these. Oftentimes they don't come to our patients, don't come to us until they already have an infection. So your localized infection is going to be what it says, local, in that redness, erythema, warmth, and that's going to have more cellulitic issues in the area of the wound. And it's going to start progressing past the wounds as well. Systemically, unfortunately, that's where we want to prevent everything from occurring to get to systemic. When we get systemic and sepsis, that can be more of a focus on trying to save the patient's life than it is to treat the wound. So if we look at this clinically, contamination, that looks like a pretty wound to me. Not pretty as in I don't want to have anyone have this type of wound, but this is clean. It has good tissue perfusion. We have a lot of that red blood coming through that area. This is an acute wound, a surgical wound. We can see that. When you get your classic signs of wound infection, you're going to get that redness, the heat, pain, swelling, and we're not seeing that here. But when you move on further, colonization, you're still going to see some of that bacteria influx. You see that there's a difference between that contaminated wound and that colonized wound. There are differences in that tissue that is very apparent. There is more bacteria in here, but it's not affecting the peri wound. It's not affecting the patient as much. And this is an area where you want to look, the opportunity is ours to, when our patients are at this point, that we can affect their wound progression and we can actually treat these wounds. We can help prevent infection. We can invent and take care of the bacteria that is currently there. When we progress to further issues though, at critical colonization, it's going to be harder. You're going to have more of that biofilm. It's very tough to break through biofilm. There are some products out there that can do it, but typically we have to use mechanical debridement, sharp debridement, irrigation, those types of things to get through that biofilm, because that at this point, that bacteria has been given the chance to build a wall on that wound. And this one you can see that peri wound is red, swollen. You have a little bit of a cellular look out there. You are probably going to feel warmth on that area. The patient is likely going to complain of pain, possibly odor, and this is going to take a much longer time to heal without proper treatment than your other wounds would. So this, again, thinking about your opportunities to heal the wounds and take care of the patients early in the process is really important. But again, often we do not see those patients until they have a localized infection like this, where we're going to have to de-roof that and make sure that we get any type of bacteria out. But when we get to that localized or systemic infection, again, we're trying to save that patient's life. We want to get their perfusion better. We need to make sure that we're looking at them systemically, not just topically. And so those are things that we want to look at when your clinical image comes into play. With our management strategies, prevention, as I've mentioned multiple times, when you're in those early phases of healing, we absolutely, or the contaminated or even critically colonized is even early enough that we can help to prevent the problems from getting worse. When we're cleaning that wound at the initial assessment, we want to make sure we're getting that peri wound taken care of too. We want to clean all the bacteria from the wound. We need to get the best clean environment to start with our assessments. We want to kill off anything that could be potentially harmful to the wound as we prepare for that wound healing. And so those proper and effective cleansing products really come into play. Obviously, we have to debride when necessary and make sure that, or we could even use invasive irrigation that can definitely help with that mechanical debridement of the patients. Providing proper dressing selections, of course, is going to be based on your best practices for your wound and peri wound. And the change schedule is dependent on your assessment. Some will require increased amounts of dressing changes. Exudate levels can change. The actives that we apply to the wound absolutely can change. So again, all these wounds are contaminated. And so it's up to us to guide that wound treatment, providing the best atmosphere for healing. And so when we think about these wounds, chronic wounds are going to take a longer time to heal. So we got to make sure that we keep in mind the mechanisms of action or benefits of the cleansing agents that you're using. You want to have a broad spectrum, antimicrobial, non-cytotoxic product to ensure you're not ruining good flora that the body must need and needs to have. And your goal is to help gain the control of the inflammatory process that's occurring by minimizing or eliminating that bacterial growth in the wound and the peri-wound. And this is where I've had issues before, is some of these products in the IFU state they're good for the wound. Some state that it's good for the peri-wound or intact skin. There are some that even say, do not use this product on an open wound. And so that's where you really need to look at that IFU and the 510K to be sure what you're using. So again, you're going to control that inflammatory process. You're going to eliminate or minimize that bacterial growth in your wound and peri-wound. You are wanting to use this at least short term, but having a product you can use long term that's non-cytotoxic is also beneficial. It's not only going to kill and kickstart that wound healing, but it's going to be safe and effective and can be considered to use throughout the healing process of the patient. Identifying what the pathogen is. And obviously that's very important that we look at what type of bacteria are we killing? What are we looking to try to manage? Biopsying the wound is going to give you the most pathogenic quantification and give you resistance information as well. If you swab a wound, which is what we do often, please be sure to follow the best practices of swabbing a wound so that you're getting the best outcome of that swab and you're getting the best organism information that you can get from a swab. But if you can biopsy, much better than you can just swabbing the wound. And then with your proper diagnostic and interventions, if there is potentially any type of bone involved, make sure there's MRI at least that's going to provide your sensitivities. And if there is an infection confirmed, bone biopsy is going to help you identify that organism that needs systemic treatment. Any bone involvement is going to need systemic treatment, not just topical treatment. And surgical intervention might be necessary with all of that. A key point to remember is that if you have a chronic wound in a close proximity to your bone and you have not ruled out osteo, you can get the wound to heal. We've done it before, but you take the risk of that wound opening back up and having further issues. And these are the repeat wounds are often harder to heal, take longer to heal. Our hosts don't do as well with healing with that. And so we want to take care of the issue in the first place. So if you have a chronic wound or anything that's close to the proximity of a bone, please look at those different diagnostic and interventions that could be necessary for those patients. Any bone involvement is going to need systemic antibiotics. So we can get that bone treated from the wound and the bone treated from the inside out, as well as treating from the outside in with our topicals. This is often when we miss that opportunity. And if we don't resolve that osteo, we can convert into more chronic wounds that can take forever to heal. And that's also something that we don't want our patients to go through. So think about that topical agent. If there's an infection present, you're going to need to look systemic. And so there is a lot of benefit of getting penetration to the tissues with certain products, but that penetration on most products won't go deeper than the top layer. We'll talk about our couple products today, which do treat deeper into the wound as well, and that's why it's an innovative antimicrobial, but often they're treating that just main top layer of that tissue. And so we want to look at the systemic side, especially with infection that is present. When you're setting up your dressing changes and your assessment schedules, make sure that you're variating things. Your wounds are going to change. Your cycles and treatment cycles should look different. You're really not going to start the dressings. You're not going to end up with the same dressings that you started with. Each of these wounds, especially infected wounds, are going to change often. So you're going to likely need to assess them more often in the first part of your wound and wound healing. Even if it's daily, we don't want to do dressing changes every day, but sometimes it's necessary, especially with these infected wounds that have that change even from day 1 to day 2 with what we're using topically. You're really going to think about that key recommendation of how to treat that level of infection. The larger the infection, the more frequent your assessments are going to need to be. So pay attention particularly to the white blood cells, their CRPs, their glucose levels, and their vital signs. And we want to make sure we're looking at the drainage amounts, understanding what your patient needs, know the compliance of your patient, and figure out what is going to be best for their wounds. Hospitalized patients are a lot easier for us, so we can assess them more often, but it will take more at points in the outpatient setting as well. Have them come back if they can more often, or change that dressing more often if they do have an infection going on. So let's get into some of the product side of it. This is supposed to be about innovative antimicrobials. And so what we want to talk about is, first of all, what are we using? And second of all, what else is out there? And so key things that we want to think about with skin and wound cleansers. First, we've already said bacteria lives everywhere, and every bit of your skin is contaminated with bacteria or pathogens, normal flora. And with our intact skin, it's not going to cause an issue. But because it lives everywhere and there's different types of bacteria in all the areas of our body, these can cause problems when our tissue opens. So skin and wound cleansers, they're indicated to help minimize that microbial burden in and around the wound. Again, read your IFUs because this is very important. If it says it cannot be used in a wound, be careful. Don't use it in the wound because it's not been studied to a point to say that the FDA has approved it to be used on open tissue. And so if it doesn't say in a wound, make sure you're not using it in the wound. And be sure that you're taking care of that peri wound as well. The peri wound in the intact skin on the outside of the tissue does contain that flora, and we've got to be sure that we're making sure that that flora does not replicate and cause problems inside the wound. That flora is meant to be there on the outside of our tissue on our normal skin, and when it becomes a wound, there could be issues. So best practices are always going to come in play. Moist wound healing, think about your assessments, your tissue management, your infection management, the moisture management, so that we can get those edges and epithelialization to occur. Some of our skin and wound cleansers. So these actives you've seen, all of you have seen different products used to clean the wounds. Now, each of these, if you go through each of these types of products, there are going to be pros and cons really for every single type of active ingredient in products. You've got to make sure that they're non-cytotoxic to the patients. They have to be at a specific level of quantity level and percentage present in your wound, in your dressings. Not dressings, but your skin actives and your cleansers, I'm sorry. So these are common ones that we see. Sterile water is often used on cleaning wounds. Normal saline, that is usually the most safe product to use and available and inexpensive. We commonly use that product. There are some cons to saline as well. And so there's interesting research behind all of these that you're seeing here listed. Hypochlorous acid is a common product that is in wound cleansers. Sodium hypochlorite at the safe levels is a really great cleanser and odor management. Chlorhexidine, iodine, PHMB, we do have a little bit of controversy with some of those due to research and evidence that has been shown on some of these on intact wounds, or I'm sorry, open wounds, as well as potential complications from different products. So again, be sure you're reading your IFUs, make sure you know the product you're using, and that's going to really help you make good decisions for your patient's outcomes. So today we want to talk about some innovation products, and these products are available through Stevens throughout Canada. We're going to start with the wound cleanser, which is Anasept. And so Anasept is a skin and wound cleanser and gel. And so if you look at this photo, you're going to see the two on the left-hand side. Those are our gel sizes. And then your middle blue bottle, that is an irrigation one that we use with negative pressure, or we can use it with ultrasonic irrigation machines. It's spikeable. And so you are able to use that with those types of wounds. The other four there are your liquids and your cleansers, the cleanser liquids. There is one there that's in a spray, and that spray does provide a small amount of PSI. I think that just skipped a little bit. Does provide a small amount of PSI, which is going to be a little bit of a mechanical debrider, but still, if you have bioburden, you're going to want to either scrub that wound or debride and make sure you're getting through that really tight knit of bacteria. But the sooner in the process of the wound healing that you use this product, you absolutely can prevent that bacteria from replicating and growing, as we showed and talked about what happens with bacteria. The more you can kill off the bacteria, the less problematic it's going to be, and the less apt you're going to get biofilm growing and progression of biofilm in your wound. So with Anasept, when we look at the components of the product and how it works, there are 3 separate key components that are providing action in the wound. When we look at and think about skin and wound cleansers, the active and additive ingredients make the major difference in how the product's going to work and how to best choose which product's going to be best for your patient. So Anasept is going to have multiple actions of kill, and that helps to make your broad spectrum, FDA cleared broad spectrum antimicrobial product that is safe, effective, and quick acting. If you see products that don't say FDA cleared for these purposes, it's likely that they haven't gone through the testing for it, or that their product has a ingredient that is put in there as a additive that is not clearing the FDA for antimicrobial benefits in that specific product. So that is what we have to think about. In this product, you're going to have sodium chloride, which is what's going to make the product isotonic. And sodium chloride also has properties that have antiseptic or antiviral benefits to it. Hypochlorous acid, that's going to be a powerful antioxidant. Broad spectrum antimicrobial, yes, but also with this product and how it's made synergistically with the sodium hypochlorite, you are going to have the best of all 3 of these products. So I just then showed you a list, and there's 3 ingredients from that list that are in this product. And this Anasept formulation, it is proprietary. And so with the buffer, the hypochlorous acid, the sodium hypochlorite, and it all being in that isotonic state, we have to look at, why is this so neat? It is specifically made and manufactured by only one manufacturer. It cannot be replicated, and it is done in the US. And so that's something really neat about the product. So multiple mechanisms of bacteria kill: bactericidal, sporicidal, fungicidal, virucidal, all tested, all very well researched about this product, and really a great outcome when you're using the product. I do use this myself, and I have used it for many different reasons. My favorite is on my children, because I have 3 teenage boys and a 4-year-old girl, and those are, that's problematic just thinking about those ages anyways. So when you're using this professional indications, you're looking at your wounds. You see a good list here, and it's going to say ulcers on pressures, injuries, and the degrees for burns, because this was approved by the FDA before we changed that terminology. And so look at the professional indications and the over-the-counter. So this can be used on intact skin, thinking that peri-wound area, minor cuts, irritations, those scrapes, those little bit of cleansing through the debris from abrasions. Somebody scraping their knee, this is a great product. It doesn't burn, it doesn't sting, it doesn't have any of those issues. You can use it on your intact skin as a cleanser and a highly effective prophylactic product. That is going to be helpful for initial use as well as prolonged treatment. Or your irrigation solution with negative pressure. You can use this for however long you want, and this is going to be helpful to keep those areas clean. We know that commonly patients will have issues with negative pressure, and this is going to be a helpful product you can use as an irrigation with negative pressure. It can be used on a variety of different etiologies of wounds with antimicrobial, bactericidal, sporicidal, fungicidal, virucidal, all the different cidals. It's going to be helpful for all of those different things. And we do have time and kill studies that are available for you to see as well. It is broad spectrum antimicrobial, and stable for 14 weeks. After you open the product, you can keep using it for 14 weeks without it expiring. And so if you're using it in the hospital, you can send it home with the patients, use it for 14 weeks, and it's going to be beneficial. You can use it daily, you can use it every other day if you're doing dressing changes every other day. The gel, you can leave it on for 3 days, and that's going to help promote and enhance autolytic debridement when you have some of that necrotic tissue or even slough showing in that wound. And that gel formulation is the exact same as the cleanser. You can use both of them. The gel just can stay on a little longer to help promote some of that autolytic debridement to occur. Some of your other top benefits are your non-toxicity, non-cytotoxic. Remember, think about some of these products that can absolutely affect our fibroblasts or our keratinocytes. That's going to affect the healing and not allow it to epithelialize. That's not only for wound cleansers, but some silvers out there too, which we'll get to next. It's not going to burn or irritate the patients. No stinging has been recorded at all for this product. The levels of the products are very natural. And so when you have natural levels, that's going to be helpful with it not being toxic to those mammalian cells. Our human cells are very sensitive at times. And so we want to make sure we're not going to kill off some of those vital things that we need for healing. It does not prolong the inflammatory signaling cascade, and actually it's going to improve that, because the more you kill off bacteria, the less that inflammatory signaling cascade is going to be necessary. So let's kill off that bacteria, prevent that inflammation from occurring, or treat the inflammation that is there if you have something that is treated. And think about isotonic. Isotonic means that it is the same osmotic pressure as the human body and those mammalian cells. And in that wound, it will not cause cellular death or dehydration or overhydration. Sterile water or tap water, if somebody's using that for some reason, that absolutely can cause overhydration in a wound. Some products can cause dehydration. Our whole point is to allow proper and efficient effects to occur and moist wound healing, right? Our best practices that we have to follow. So think about all these different things. Anasept can stay in a wound for 5 to 7 days. They have done testing that up to 7 days on killing these products, or killing the bacteria without adding any more Anasept. And so that's something we can go through if you have more questions on the kill times when we visit. You can use it at every dressing change, or multiple times a day even, or once a day if you're doing dressing changes once a day. Especially with negative pressure, if you want to do irrigation once a day. Those critically colonized and actively infected wounds do usually require prolonged exposure to help with your bioburden control. So think about those gel to use on those types of wounds if you have problems with actual fully critically colonized or infected areas. So that's what I'm going to tell about Anasept today. There is a lot more to learn about it. However, today we're just going to talk about that part. So now let's go into silver. Thinking about silvers. Silver ions are going to, silver, first of all, is something all of us have used, and especially in wound care. But when we look at how silver ions kill, think about the ions. The ion is the only antimicrobial portion of that silver. And so what we want to look at is, how does that silver ion kill the bacteria? And so I'm going to play that one more time. The silver ion first is going to suffocate that bacteria. That ion binds to the receptor on the cell wall, preventing cellular respiration. So we are going to suffocate and make it so that bacteria can't breathe. We're going to starve that bacteria, and that ion that's present, it prevents the cell from taking in any further nutrients. Then we're going to alter the DNA, and so that prevents replication from occurring. The ion penetrates into the cell wall, disrupting the DNA and preventing replication. And so with these things happening, we are going to be able to have different avenues of killing with our bacteria. And that's going to improve the antimicrobial benefit of silver. That incidence of, with those different avenues of kill, the incidence of pathogen resistance is going to be almost zero. which makes silver such a wonderful option and for our antimicrobial product or microbial control. So elemental silver is going to work the same for all silvers. It doesn't change from one silver to another. And so we got to make sure we remember that. However, the way the dressing is made can affect how that product works and the potential side effects. So you've got to know your products. You've got to know your IFUs and your 510Ks. Is the product using pure silver, or is it an adulterated substrate? What other chemicals are mixed in with the silver? So when are we going to have issues with our wounds? Could they be causing pain, burning, or any type of discoloration? Think about the product that you're using and how it's going to benefit your patient. So before we talk about the Silverlon, let's review a few points that I like to talk about with silver generally in the market. These are terms you've heard before, right? So think about nanocrystalline. That's a nano, comes from the Greek word nanos, meaning dwarf. So it's a small, very, 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 very small metallic silver, just like all other metallic silvers. It's same as metallic silver, elemental silver, but it is a very small particle. Colloidal is going to be made up of tiny nanoparticles of metallic silver. It's going to be suspended in a liquid, and then you cannot remove that through a normal filtering process. So this is when we used to hear about people drinking silver. That was going to be your colloidal silver. And so that's when people had that blue symptoms and turning blue and the skin turning blue. Ionic silver, that's your dissolved silver. That's when you're stripping the ion from that silver, and that is the antimicrobial effect of silver. Ionic silver has the same antimicrobial properties as the others, but has no metal in it. And so that ionic silver, which is released in every silver dressing, the ion is released when the fluid hits it. And so ionic silver, if you see it on the products, ionic silver is antimicrobial silver. And that's what you really have got to pay attention to when you're looking for your products and how is it working. But what are the side effects that might actually occur with that ionic silver as well? And silver sulfadiazines, that's something you've heard of, I know, with and we've used it for decades, especially in burns. And so that also has different benefits, features, benefits, and problems that come with it. Your types of dressings. Impregnated dressings, again, IFUs, so important. Impregnated dressings are usually going to only treat the bacteria in the dressing. So read your IFU. This means that silver is not going to exit that dressing. And so if you're trying to penetrate deeper into those wounds for antimicrobial benefits, your impregnated dressings are not going to release those types of silver. It's going to treat the bacteria in the dressing. It states that directly in the IFU. So please be sure to read those things. Silver coated is going to be similar, except for the coating of the silver coated products can release from the product. Now this, when you think about it on coating, it depends on what it's coated with. Can that cause damage to the fibroblasts? Can it cause problems to keratinocytes? And those are things that you have to look through the research for and know your IFUs. Coated dressings often cause issues with fibroblasts because it's releasing either particles of the dressing or it's silver, metallic silver directly into the wound, and that can cause issues, especially if it's not activated to be ionic. Silver particulate dressings are going to be particles, those nanocrystallines. Nanocrystallines and particulate dressings can absolutely exit the dressing and go into the wound. When you look at IFUs on a lot of those products, they're going to mention staining, burning, other problems like that. And so you want to keep in mind the differences and read your precautions, cautions, and indications for each of your dressings. Today, we are going to talk about a plated dressing. And so Silverlon is a plated dressing. And what that means is that every single weave of that dressing, so think about your clothes, kind of open the, stretch out your clothing. This is a nylon dressing. So it is made with something that has specific weaves. Each weave of that dressing has silver plated on the top, the bottom, in between every single weave of that dressing. and it is permanently plated on the dressing, meaning that it will not drop any type of silver into the wound. But when you activate your product, it will absolutely release the silver ion. That ion, which is that antimicrobial part of the silver dressing, is being released into the dressing without releasing any type of particles or any other complicating factors that some dressings might have. So in each weave, it is plated and a very high level of silver as well. The background of this, and so quickly through that, is its military background. That is, it was developed for combat injuries and patients that have problems with the combat fields. When we think about this, there's so much more bacteria that's on a battlefield than what we'll see in normal day. And so BARDA, which is a research institute, they did a lot of studies on this product to make sure it's not just antimicrobial to the basic bacterias, but severe bacterias and sulfa mustard injuries, which we're not going to see. But it also got cleared for an MRI indication, FDA approved for MRI. Silverlon can go in and out of the MRI, CAT scans, X-rays without causing damage to the wound or to the image that is occurring. That is not on any other silver dressing out there. And so this is going to be very different with your MRIs. Really important because the product focus lines that we have are going to be burn, which burn patients go in and out of MRIs constantly. Your IVCD, or those little patch dressings that go around your central line areas, negative pressure dressings, surgical dressings, all of these things may go back in and out of an MRI, and you will not have to remove the dressing from the patient. Silver works the same again with everything. We've all used silver since the Roman times till now, and there's so many different things about silver that we've been taught over the times. Think about again how it comes back to how the product is made. Everyone has a dressing, but it really depends on how the product is made, on what complications might actually occur with that dressing being used. Think with Silverlon, again, it is going to be plated. So it's plated, meaning that there's going to be anywhere from 50 to 100 times more silver, 546 milligrams per 100 square centimeters. But it is not dropping any silver. It cannot systemically absorb. Your body is going to have only the silver ions that get into the wound tissue and deeper into that wound. So not only are you treating that topical part, but it can penetrate down because it is just that ion that is getting into the wound. So that's powerfully antimicrobial immediately upon putting it on the wound. And this is the primary dressing. So if you're using it under negative pressure, you do not want to put anything under it. This is the primary dressing always. And yes, it does need to be activated to strip that ion to be able to release the ionic silver to the wound. And so that is very important. We want to keep this dressing wet, and we give you those benefits and how to do that further if you're using the product. It is supported by a lot of research. And so I will show you a little bit of that in just a second. We mentioned BARDA. BARDA did a lot of research behind this. Major burn bacteria are listed on here, which is why this is such a great burn product. And remember, antimicrobial products by the FDA, really to get it cleared to be antimicrobial, you only have to kill 5 basic bacteria. But BARDA went on and tried to show that you could really use this on any type of bacteria out there. And that's really what is most beneficial. Early treatment with the Silverlon. So in that colonized time, to prevent bacteria from going to critically colonized. We know some of these chronic wounds are going to move into a progression of critical colonization if we don't affect that bacteria growth. So if you use this earlier, this is going to help decrease your bacteria counts, and that will help reduce the opportunity for biofilm to produce. If biofilm is already there, really no silvers are going to break through that biofilm. Silver itself won't. However, if you can prevent those biofilm bacteria from being able to form that tight weave, then you can decrease that risk of biofilm being able to form in these wounds. So Think about early treatment with Silverlon and prolonged treatment as well. You can use this for 7 days at a time. Really, you use it up to 30 days. Give it a break for a day and go back to it if you still notice that you're having issues with the wound and you are seeing great progression, because that's what we end up doing a lot, is giving them a 24-hour break off of silver and putting them back on. This is not going to systemically absorb. It is not going to be able to alter. You're not going to see any type of resistancy, because it is just the ion that is entering into the wound. Clinical literature is available: burns, military, wound, surgical, silver medicine generally, which actually talks about the mechanisms of action of the product, negative pressure, central line, and that's a big one with LVADs and ECMOs recently. If you have infection control people who are looking for something to help, that might not be CHG. So these are things that we really can back with evidence. These are my references, and these are my colleagues. So I have two colleagues there in Canada that represent MTSG. We have Carol Robinson and Doreen Eddy, and those both are going to come back on screen here in just a second. Their contact information is here on the screen. All of these products are available in Canada through Stevens, and Anasept is an awarded product by Health Pro and Mohawk Medbuy Wound Care Contracts. So you have the availability all over Canada, not just one region or another. But if you're from Ontario, Quebec, or the Atlantic Canada areas, you would reach out to Carol and she would be able to assist you. And if you're in British Columbia, Alberta, Manitoba, or Saskatchewan, that would be Doreen. And so thank you for your time. Again, I am Theresa. I appreciate you all being here, and I'm happy to answer any questions that you may have.
That is fantastic. Thank you so much for going through this. I'm seeing all the claps and thumbs up emojis in the webinar here. Really appreciate that. And welcome to the chat here, or to the call here, Carol and Doreen. One of the questions we have from the top here, I know you were sort of mentioning, getting into that a little bit there at the end, Theresa, but we do just even look at the names in our chat. Well, we do a lot of our acute care colleagues. We have quite a few people in community here. There are community nurses. We're just wondering where the best way to get access to Anasept might be. I don't know if Carol or Doreen, this might be we could kind of look to you first maybe for an answer.
Yeah. And I think part of that is going to depend on whereabouts you are in Canada in terms of the community. As Theresa mentioned, it is available through both Health Pro contracts, Health Pro awards, multi-vendor awards, and through Mohawk Medbuy. Then some of the provinces, obviously, if we look at, say, BC as an example, PHSA, they purchase and utilize Anasept fairly extensively. You'd be able to get that through the provincial buying group. So it really is going to depend somewhat on where you are. If you have somewhere specific and you'd like to just reach out, then we can certainly help to understand exactly what process you would need to go through to be able to get that within the community.
Lovely. Okay, that's perfect. And I'm sure we'll have multiple ways of getting in touch with both you after. I know we'll get some emails out to our attendees here for sure. One of the questions we had as well was about Anasept again. Does it have a color to it, or does it stain? I know, for example, iodine stains orange. Is this something that you've come into knowledge about?
No, so it is a clear liquid, and it will not stain. It does have sodium hypochlorite in it as well, though, and so we always, take your precautions on clothing, but really it shouldn't cause any issues at all. I've washed it out of my clothing before as well, and so no staining. There is a slight odor to it, and that what you're really smelling is the combination of the three products together that might be noticeable for some people, but not noticeable for others.
Lovely. I know we're getting quite a few questions about Ontario specifically, so maybe we'll just direct for those in the chat who want to get in touch. Maybe what we'll do is you can see on screen there about the emails and phones for Carol and Doreen. It might be the best to reach out to them specifically. I'm sure both of you would be able to help with that there.
Yeah, absolutely. For Ontario, if they want to reach out to me, it is available, as Theresa mentioned, through Stevens. And then really it will be approaching the individual HCCSS in terms of, you know, what they want to see in terms of bringing it onto their formulary. So certainly I'd be happy to work with you on that.
Fantastic. And I'm seeing a question come up here. Is there product interaction for Anasept? I'm not sure if that makes sense right off the top to you there.
Yeah. So there is not technically interaction. However, with any type of product that has hypochlorous acid or sodium hypochlorite in it, you would not want to mix that with any silver products. Silver is very sensitive to any type of agents like that. And so you wouldn't want to activate. So I wouldn't use Anasept to activate Silverlon. I would use Anasept first, clean my wound, my peri wound, and let it dry, or I would clear out any excess before I would put Silverlon on it. And I would activate my Silverlon with sterile water or saline. And so those are the things that you would want to not combine. You wouldn't want to activate your silver products or antimicrobial products with it, because that could cause some type of problem.
Lovely. And this question should be fairly quick to answer too. I know you were mentioning it very briefly at the end. I think it was in the bifold about being used under negative pressure wound therapy. Could you maybe just comment about that for a second?
Yes, of course. So there is a specific SKU range that is made for negative pressure, and it has different open pores that are made specifically to use under foam dressings and your negative pressure wound therapy. And so the Silverlon is made differently in the weave that is most beneficial for your negative pressure patients.
Perfect. And I think we got a couple more questions coming up about Silverlon here. One, I think it was in the chat there. Can it be cut to fit was one question. Yeah.
Yep. And so Silverlon it comes in all sorts of rolls and sizes, shapes. You have specialty dressings. You can get like hand gloves, and you can get chest dressings. Otherwise, we have rolls and different sizes and shapes. What I do, especially for burn patients, is I'll cut a little slit into each of my sides of my dressing, and I'll tie them together because it's nylon. Think about tying your clothes around your waist. It's the same idea. You can tie the dressings instead of having to tape everything. And so that's helpful when you're wanting to design your dressings and make it so it's more usable for your patients.
Lovely. And in the chat, I'm just going to look at this one as well before I miss it. Does Silverlon need previous activation before you can apply it?
Yes. So you do have to activate it with normal saline, sterile water. If you know you have an excess amount of wound drainage or exudate, then that absolutely would activate it as well. But really, even for those patients that have wound drainage, I still activate every dressing before I put it on. And I usually am using saline. When you find saline in some of the research and literature, you're going to find that lots of these products out there that are silver products state that they cannot be activated with saline. And this product does not have that rule to it. You absolutely can use saline to activate and reactivate this product. And if your wound starts drying, you can add more saline to it. And so that's what makes it so easy for you to be able to use for these patients.
Amazing. And I think I see Paula saying in the chat, love wound care. And it was asking a question, how long can it be left on? I think this is referring, well, I guess to both, I guess. But would you be able to answer that as well? I know you mentioned at the very end of the presentation.
Yep. So how long can it be left on for the Silverlon is going to be your 7-day wear time. In the IFU, you will see, and I'll give this to you, in the IFU, you will see that there's a 30-day. And if you take a break from 30 days, you take a 1-day break, you can go back on it. There has not been any resistancy to the product that has been found. And so you absolutely want to just give that a little break and make sure you reassess that at the 30 days. And then determine if you want to continue using the Silverlon or not. And we have a lot of people who use Silverlon through the duration of their wounds and chronic wounds that can take months, even years of healing. And so you can use it really for however long you want, but I would give it a break at about 30 days, a 24-hour break. But yes, it's 7-day wear time for the products.
Perfect. And for someone's asking about in situations where you might have undermining wounds or tunnel wounds, can it be cut in a ribbon or in a way to help with that?
Yeah, it comes in a ribbon. We have actually a ribbon product. And so for those cavity wounds, You absolutely can cut it into a ribbon. Some people will even twist up some of the product. It's a nylon. It is not going to tear in these wounds. And so some will take that product and make their own ribbons as well. But there is a product specifically made for cavity wounds.
Amazing. And I know we've got a couple other questions. Oh, another one just came up here. Just to reiterate again, that Silverlon can be used as an interface under negative pressure wound therapy. And we were mentioning that we can there.
Yep.
Can it be used with a wound vac?
Yep.
There we go.
All
Lovely.
the same with negative pressure, absolutely. And it's when you look at the product numbers, the NPD is the negative pressure dressing. And so if you're going to look at our products, NPD is going to be negative pressure, WCD is going to be wound care. And so there's differences in the weaves on those, but negative pressure specifically is made, although you could use them both under negative pressure, that's the one that has the best pore shapes and sizes for negative pressure.
Here, someone's asking about preventing infection for patients who are immunocompromised. This person asks, when do we draw the line about antimicrobial stewardship?
You know, our immunocompromised patients are very difficult because every situation is going to be a bit different with our patients. So you're really, for me, what I think of, and I can only give you my own personal experience when it comes to this, is if I can prevent my immunocompromised patients from having any type of bacteria enter into their wounds, I am going to do this. My whole point is to prevent anything from colonization moving into critical colonization. And our immunocompromised patients really do have issues with that happening. And then they are the ones that we are treating forever because their wounds can't heal. So for me, I really don't stop treating them with antimicrobial products. I want to keep the prevention rate or the infection rate down as much as possible to be sure that I am not allowing antimicrobial growth. And so again, that's just from my own personal things. I've used Anasept from the beginning to the end with some of my cancer patients and patients that have massive wounds, even with their patients that have fungating wounds, because unfortunately, that is going to be one that odor is an issue for, but also you're not going to heal those wounds. So palliative is a reason why we use these products. And you're right, when do we stop? That really is up to your discretion. But for me, I try to continue it through as long as I can and as long as the products are still working for the patients.
Fantastic. And I'm seeing just in the chat, there's a question from Janet Boye about whether there are discs that fit around some of our intravenous catheters. Is that something that it comes in?
Yes. So there's multiple sizes of the catheters, anywhere from like the little teeny tiny baby infant NICU size up to a square, which we use more towards the LVADs and ECMOs. And so the LVADs, ECMOs, those are going to be quite large for large French tube sizes. So yes, there is something to fit anywhere from your babies up to, or even we can use them around like epidural catheters, very, very, very small, up to your ECMOs. So anything in between would absolutely fit. I think there's a 4 millimeter and a 7 millimeter, and then even larger.
Fantastic. And I think you mentioned it briefly, but Maggie's also asking here, are there any contraindications, any side effects for using Silverlon?
No contraindications really, because this is a product that actually does not penetrate silver into the wounds. You really can use it for anything. When you think about best practices though, your biggest contraindication is going to be a non-excised full thickness wound or full thickness burn. We know in burn, at least we would have to excise it and remove that thick necrotic tissue in order for us to penetrate silver through the tissue. And so non-excised full thickness burns would be contraindicated. Also, the only other contraindication for the product, and not contraindication, but please do not activate it with anything that would be cytotoxic. And so any type, you want to activate Silverlon so that it is moist during the time of use. However, we don't want to activate it with anything that might complicate the silver effect. With Silverlon, it does not deactivate with saline, where with saline, many other silvers will deactivate. This product, you absolutely can use silver to activate it, but I would request that you stay away from anything cytotoxic.
Fantastic. I know we have just a couple minutes here. I'm gonna, if anyone has any other questions, please feel free to put those in the Q&A box. Maybe what I'll do is I'll ask Doreen or Carol if there's anything else you wanted to add here, if there's anything else you want to mention about getting in touch with MTSG, anything you want to say as well.
Yeah, thank you very much, Troy and Theresa. Yes, please feel free to reach out to Doreen or I if it's in relation, any questions related to the product or any discussion in terms of how it can be made available. And also if you're interested in evaluating the product, we'd love to let you have the opportunity to evaluate it and to get your input and insight back on the results.
Fantastic. So I think with that, I don't see any other questions coming in. I want to thank everyone who came on today. I know for some people it's in the middle of the workday, so if you've taken some time away from your shift, we really appreciate you coming on here today. Again, Theresa, thank you so much for giving us your time, not just today, but yesterday as well. And to MTSG again for making the education on both of these days possible. I know in our chat earlier today, we saw there was someone who was mentioning they were so thankful there was a second session because their power went out last night. So they're able to finish it today, which is fantastic. So I know this won't be the last time we have a partnership with you, and we hope to see you again soon in an educational capacity and again in the future, hopefully at conference. For anyone who's looking to still get the registration for conference, you'll definitely get a chance to see them there too. So without further ado, we'll say thank you for today. Have a good rest of the day, and we'll talk to you next time.
Thanks
Wonderful.
very much, everybody.
Thank you.
Bye, everyone.